in the sports situation, you don't get back into the game if you're symptomatic at 15 minutes. So what does that mean? They don't determine whether or not the person is able to go back in the game at 2 minutes. They wait 15. If there's no symptoms at 15, they send them back in. If they're symptomatic at 15 minutes, they don't get back into the game until their symptoms have cleared for a significant period of time. If it's classified as a significant concussion, they don't get back into the game until their symptoms have cleared for 7 full days. Now here's what is significantly different about the way average people with head injuries, brain injuries in motor vehicle accident, falls are treated in athletes. With an athlete, let's take an NFL quarterback again, there is millions of dollars at stake as to whether or not and when that person can play again. Now, that means every day that they continue to be symptomatic is a problem. So that means every day some expert in the field of brain injury, or at least in the field of sport concussion, is evaluating them to see if they're still symptomatic. If we could take that model of daily evaluations to see if the symptoms are cleared and apply that to the injuries that happen in motor vehicles and car wrecks, we would then be able to sort out the accidents and injuries and the brain injuries that are significant from those that are not. What I would like to see is a change in 2 significant things with respect to the way people who have head injuries, brain injuries, concussions in motor vehicle and other accidents are treated. The first is there has to be an analysis done of memory, not confusion. We have to take time and we have to look to see whether or not there's actually been an inability to remember things, not just the capacity to appear to not be confused. For example, we've got to start asking questions of people for what happened between the period of time 5 minutes after the car wreck and the time they get to the hospital. Every single competent ER doctor is going to ask people what happened in the accident. And because of the effect of adrenaline, they are in all likelihood going to remember. Do they ever ask them anything about the ambulance ride? If they would just ask them about the ambulance ride, we would get so much more information about whether there was a concussion than we're going to get just by asking them about the accident. Let's just say, for the sake of argument, and I don't believe this, I think it's a longer period of time. Let's say it's half an hour after an accident where the symptoms actually start to be significant enough that continuous memory, which is the definition of amnesia, continuous memory is interrupted. So if it's a half an hour and they're at the scene and they don't get into the ambulance till a half an hour, if you ask them something in the emergency room about their ride in the ambulance, you will learn more about whether or not their memory is working than you're going to learn by asking them questions about confusion, or asking them questions about things that they knew perfectly before the accident. For example, they probably know what day it is. They certainly know who they are, and they in all likelihood know where they are. Again, amnesia is not a complete absence of memory. It's not as portrayed in the movies. It's the inability to record all of the memories. One of my friends, who's an extremely knowledgeable man in the field of brain injury, says, I look for amnesia not based on whether they remember things. It's remember how much they remember of a day. And post-traumatic amnesia, in his definition, ends when they begin to have 16 hours of memory a day, not 1 hour or 2 hours. If the days are too short, that probably means they're not remembering everything. All right, half an hour, that would be good. The ambulance ride, that would be good. But what about what they were doing from the time they got to the hospital until the time they were brought into the room? Now, the perfect hospital, you get in an ambulance, they take you in, and the doctor's talking to you right away. the imperfect hospital, you spend 20 minutes talking to someone about your insurance billing, and then you sit and wait. And maybe a nurse comes in and puts you in a small room, and then you sit and wait. If the doctor would ask, tell me about your conversation with the nurse 20 minutes ago, or the conversation you had with the billing person when you got here an hour ago, we would learn a lot more about whether there's amnesia. But that's only going to tell us something about what's going on in the first 3 or 4 hours. And brain injury is a process, not an event, and it can take 72 hours for the full effect of brain injury to start impacting on the mind. So more important than asking better questions about amnesia on the day of the accident, more important than asking better questions to distinguish between confusion and amnesia on the day of the accident, more important is to ask them something the next day. All of the cases where I've represented people and their loved ones were concerned enough about their behaviors the next day, those cases were all provable brain injuries. Because when you go to see the doctor 24 hours after your concussion, and it is a significant concussion, then it becomes obvious, even to the busy doctors in the emergency room, then it becomes obvious that the amnesia has started to affect, that they are confused, not necessarily about where they are at that moment, but what they've been doing. So if we're really going to improve how people are treated with respect to, or people are diagnosed with respect to having concussions or mild brain injuries, the key thing is to make sure they go see the doctor, preferably back to the same emergency room, although I'm sure the insurance companies might have a problem with that. Preferably back to the same emergency room, seeing the same nurse and the same doctor they saw the day before, and then having that doctor ask them the easy questions to determine amnesia now, is what did you do since you left here? And if they can only remember a few things, they're probably having amnesia. If they can remember all of it, then they probably don't. If they don't remember anything, then it's a significant head injury. We must change the way in which we look at the potential for a long-term head injury, long-term brain injury, in the 24 hours after the accident. We must start giving the accident victims the same type of care and concern that we give athletes who are injured in sport.